Hi there, this is Andrew with Zang Physical Therapy, and what I want to do today is piggyback off on something that I talked about on Tuesday, which centered more around golf games specifically, and how having a limitation in one area, let's just say at the ankles or the hips, could impact your swing and thus cause maybe shoulder or elbow problems. So I want to look at this from a bigger view today, in that for anybody who has any kind of issue, be it knee pain, hip pain, back pain, or even take this into the upper extremity, elbow or shoulder, that we want to discover and treat the source of the problem, not just a symptom. Because in many cases, as I'm treating a patient, and this comes to mind because of an individual I treated this morning, is that the problem that they're experiencing, or the symptoms that they're experiencing, isn't just coming from that area. There's a secondary issue, or actually it's the primary issue, that we're ending up having to treat. So in the case today, the person does have knee pain, all right, and they have had surgery and injections and may ultimately need more surgery on the knee, unfortunately. But because of the knee issue, they have developed problems in the same-sided hip and back. And when I first met her, the question to answer was, is the hip and back a separate problem from the knee? And as we've come to find out, they're kind of one and the same. So as her knee hurts more and she may be walking differently, maybe with a limp, she ends up developing more hip and back issues. So, that's a case in point for anybody out there, that when they're working with a medical professional, that they're being looked at as a whole person and not just one small body part. Because if she was only looked at as a small body part and I was just examining the hip or the back, I may not have found anything and just blindly throwing stuff hoping that that would get better. When in her case, we found out that if we directly treat the knee, reduce the pain and discomfort there, it helps her to walk easier. And then the hip and back issue seems to have reduced on a significant order. So we're really only dealing with one problem versus the question mark at two or three. So the message, again, is we want to discover the source of the problem and treat that first and foremost. So in some cases, that may be a body part or joint that's away from what you think. So the other day we talked about how the ankle can impact how the body rotates and pivots, changes the shoulder dynamic, and thus leads to elbow pain. So that's a very unique circumstance. But for anybody who has an upper extremity problem, especially if they have numbness or tingling, we want to consider, is there a spine-related issue that needs to be addressed, be this the arm or the leg. So again, don't let a provider get fixated on just that one body part, be it the elbow, the knee, the ankle. Make sure they look at you as a whole person, and hopefully that will help you get back to doing the activities you love quicker and with less pain and discomfort. If you have any questions, please put them up in the chat bar and I'll get back to you, or send me an email, andrew@zangpt.com. Have a nice weekend.